Welcome to our Sunday specials. After more than 2 months riding on her motorbike from one continent to another, Chienyewa Amadi has returned to Lagos, where she started her journey to France. The journey is to raise awareness and funds for cancer survivors. We have details in this report.
Nigeria-born Chienyewa Amadi has returned to the country after a tour of one ride, many lives from Lagos to France and back to the country. The One Ride Many Lives is an initiative for cancer patients within the country.
I embarked on this journey to raise financial support for cancer warriors currently battling cancer, especially those who started their chemotherapy and stopped halfway due to the financial situation in the country and cannot finish their chemotherapy. So that was why I embarked on this journey, to bring hope where there is fear, to bring strength where there is weakness. So that's the reason I started this One Ride for a Life. It's called a ride for several cancer warriors, just to give them an opportunity to keep fighting and to win this battle over cancer.
The self-sponsored journey was without challenges and accidents.
I have a flat tire. From Lagos, Nigeria, it took me a day, so the distancing from Benin to Togo, it's not much, so it was done in one day. So I go all the way to Togo and I stopped in Lome. That was the same day. I slept in Lome and continued the next day from Lome to Sinkase. I set off to Ouagadougou, but on my way to Ouagadougou was when I had a little bit of issue with my side box. It fell off and went under my tire, but a little bit of accident anyway. So I had a little incident and my box fell. I had a crash on my hand, if you can see, tear. So that was where my journey had to pause a little bit. But the good thing about the biking community in Burkina Faso was immediately it happened, I already reached out to some bikers in Burkina Faso. I told them, this is what's happening, I need help. The transition from Guinea to Senegal border was seamless. It was awesome because I had some support from, again, the biking community. From Guinea we moved over to Senegal. Senegal was another country where I had a little bit of delay because my Mauritanian visa was not ready. I was able to get in contact with the Nigerian embassy in Senegal. They facilitated my application and I was able to get my visa, and my journey continued to Mauritania. Because people say, oh, there is no road from Nigeria to Europe, that there is no... Actually, yes, there is no road, but there is a route to going to Europe. So I had to take a ferry from Morocco, Tangier to Spain, and then I continued to France. My travel was hindered by so many struggles, the cold especially. I wasn't prepared for the cold. The riding gears I took with me were not really winter wears, because I planned initially to be out of Europe, as at that time I was entering. Because of the delay I had in Burkina, Senegal and the other countries, it delayed my time in Europe. So yeah, that's practically how my journey to Europe was.
In the year 2022 shows Nigeria records approximately 127,000 new cancer cases annually. Furthermore, an estimated 269,109 people were living with cancer within 2018 and 2022. Cancer survivors in Nigeria find it difficult to get health insurance support, with the most common type, which include breast cancer, cervical, liver, and prostate. Chienyewa hopes that many more Nigerians will come out to support those battling with this ailment. Mia Nakiri, TVC News, Lagos.